Don't let the bedbugs bite.
Hello everybody, welcome to this video. I'm Holly Wright. I'm a Weber State Doctor of Nurse Practitioner student. We're going to talk about best practices on bedbugs. We'll learn lots of things today. We're going to talk about 5 different areas: the basics, the rash, the infestation, how to treat the patient, and how to fix and prevent the problem. Bedbugs are 5 to 7 millimeters in length, and they range in size from a flaxseed to an apple seed. Bedbugs, as you can see here, are reddish brown in color. Bedbugs have been around plaguing humans for about 3,500 years. The bedbug nymphs are small and yellow, straw-colored. The bedbug eggs are white and oblong. The United States went for about 40 years without hardly any bedbug sightings. In fact, the phrase, "good night, sleep tight, don't let the bedbugs bite," had little meaning until the early 1990s when they began to resurface. Bedbugs eat about once every 5 to 7 days. Bedbugs do change shape and plump up after a nice meal. Over here on the right, you can see a large black object. That is the head of a screw. Right inside that screw hole is a bedbug hiding with her eggs. Let's talk about some bedbug basic behaviors. Once a week, the bedbugs eat. About every 5 to 7 days in the early morning hours when people are sleeping. About 70% of the bedbugs are usually hiding right on the bed itself. Bedbugs primarily eat human blood, and they are nocturnal, meaning they are up at night and they are rarely seen during the day. Bedbugs can happen to anyone, rich, poor, any community. It is important to note that 90% of the bedbugs in a room are found within 3 feet of a bed. It is important to note that bedbugs cannot fly and they cannot jump or hop, but they have been known to climb up a wall and drop from a ceiling to reach their host. These ink spots on the wood bed frame are there from the bedbug excrement. If you see a lot of tiny black ink spots, you could have an infestation. Bedbugs especially love wood, cloth, carpet, paper, dark crevices, cardboard, and you. Bedbugs and diagnosing. Over here on the left side of the screen, you see a woman who has some bedbug bites. You'll notice that the bites are on areas of the skin that can be easily exposed while someone is sleeping. Over here in the second column, we have 3 calendar days to represent that it may take 3 days, even up to 11 days, before a bedbug bite turns into a rash. A typical bedbug rash is 3 bites in a row: breakfast, lunch, and dinner. A common reaction to a bedbug looks similar to a mosquito bite. However, they can also cause lesions like wheals, vesicles, bullae, and even anaphylaxis. Bedbugs cause intense suffering to those who have them. A bedbug bite without treatment, however, will disappear and heal after 5 to up to 14 days. The woman here shows an example of how exasperating it is to our patients who have bedbugs. Over here on the right though, an elderly woman is shown here smiling because the elderly have an increased tolerance and may have no reaction to bedbug bites. In fact, up to 30% of the total population have absolutely no reaction. In order to identify bedbug infestations in your patient's home, ask them about these 6 important clues. Black ink, fecal spots on the bed, wall, and furniture are a sign of bedbugs. Have your patient look for small blood spots or specks on their sheets and bedding. Have your patients watch for tiny white oblong bedbug eggs. They are about 1 millimeter in size and look like a tiny grain of rice. Another clue of bedbug infestations in the home are the skins that are left behind the bedbugs after molting. Of course, if you see a bedbug, that's a definite sign that you have them. And an interesting clue that not many know, if there is a sweet musky odor, this could be a sign of a major infestation. Research has shown a 3-pronged approach to bedbug ailments for our patients has been most effective. These include skin treatment, eradication at the home, and a mental health assessment. A skin treatment for bedbug rash includes oral, topical, and even systemic corticosteroids. It is important to note that patients cannot get better without an eradication of an infestation. In fact, physicians are at the forefront of diagnosing, treating, and helping patients get rid of the problem. If a bedbug infestation is suspected, a mental health evaluation is an important part of treating the patient properly. Many patients experience anxiety, sleeplessness, and emotional distress. Watch for exasperation, PTSD, and even suicidality. Educating patients and stopping the problem. Stopping the bedbug problem at home is the only way to solve the problem. They need to be taught to remove clutter from the floors, vacuum carpets, floors, even cracks and crevices. It is important to dust all areas with diatomaceous earth, which is very inexpensive. Diatomaceous earth kills all bedbugs that have contact with it after 2 weeks. Do not recommend bug bombs or chemical foggers, as they increase the spread of the bedbugs into the structure or the home and make the problem worse. It is important to put mattresses and box springs inside bedbug-proof encasements. Use high heat to wash and dry all bedding. Washing alone will not kill the bedbugs and the eggs, but you must dry in high heat in order to kill the eggs as well. Preventing bedbugs from returning to your patient's environment can be done by teaching them to place their clothing and bedding in plastic storage bin or in plastic bags if they are staying in a place that is known to have bedbugs. Teach your patients to not accept any furniture or clothing unless they have inspected it and found it bedbug free. Vacuum and clean clutter regularly. If working in an environment that is known to have bedbugs, do not bring personal items, backpacks, or purses. A new and promising method using cardboard to trap and catch bedbugs is worth looking into. WinnipegBedbugHeating.com, as well as the CDC and the EPA, have very good information about bedbugs. Thank you for your time. I hope you found this interesting. If you have any questions, leave them in the comments. I will get back to you and try to answer every single one. Bedbugs primarily eat human blood, and they are nocturnal, meaning that can be easily exposed while someone is sleeping. Over here in the second column, and it's important to know that bedbugs do not fly. They have teeny tiny wings, ink spots. You could have an infestation. Bedbugs especially love wood, cloth, carpet, paper, dark crevices, cardboard, and you. Let's look at diagnosing bedbugs. What are we looking for?